Our first speaker is Dr. Mark Reed. He's a scientist and medicinal chemist at UHN's Krembil Brain Institute, also director of UHN Therapeutics. He specializes in designing small molecule drugs to treat a variety of diseases. And when he's not designing drugs, he's jamming out on the guitar, the piano, drums, or the trumpet. Obviously, a very talented guy. Mark, come on up.
Imagine watching disease unfold, but not in a hospital ward, at the scale of molecules. To truly fight disease, we need to look beneath the surface, into the invisible molecular world where disease takes shape. My role as a medicinal chemist is to create molecules that can stop disease processes in their tracks. Molecules that can become tomorrow's medicines. So, how did this all start? Well, when I was a kid, I was fascinated. Actually, I was obsessed with fire. At the age of 11, I was making gunpowder. At 12, I was generating explosive hydrogen gas from a car battery. And yes, by 13, I'd made TNT. Somewhere in there, I nearly burnt down my parents' house. It's actually a miracle I survived my teenage years. An even bigger miracle my parents had a home. But those early experiments weren't about destruction. They were about transformation. Taking simple things, combining them, and creating something completely new. I didn't know it then, but I was destined to become a chemist. Eventually, I fell in love with organic chemistry, the art of making molecules. And because organic molecules make up most of today's medicines, I realized that I could take that passion and actually give it some purpose, creating molecular tools to treat and prevent disease. So these images that you see here in front of you, these are organic molecules. They're actually all medicines. So, I want you to think of these as molecular keys. Molecular keys that can unlock disease processes. So, following the majority of my career in the pharmaceutical industry, I then joined the Krembil Brain Institute, where I now lead UHN Therapeutics. Here, my team works with researchers across disciplines to transform bold ideas into new medicines. What do we do exactly? Well, we identify druggable targets. These are key proteins in our cells that, when they malfunction, cause disease. Think of it this way. If our body is a complex machine, the proteins are its gears. When a gear breaks, we get disease. My role is to find those broken gears and design molecules to fix them. Okay, let me give you an example. We've been working with Dr. Jeremy Sivak at the Donald K. Johnson Eye Institute on a project to tackle glaucoma, a leading cause of blindness. Dr. Sivak identified this molecule, LXB4, that resolves inflammation within the retina. We then synthesized this molecule in the laboratory and used it to identify its likely protein target, alpha-ketinin. This process is known as target identification. Dr. Sivak then validated that alpha-ketinin actually plays a critical role in protecting the neurons in the retina. Okay, but our next challenge was to identify drug-like small molecules that can actually interact with alpha-ketinin. How do we do that? So, using computational chemistry, we can scan the whole surface of the protein to identify a pocket. Think of this as a molecular lock. We then, using organic chemistry, synthesize molecular keys to fit that lock. Dr. Sivak's group tested these molecules in biological systems, confirming that they do actually reduce inflammation. We are now trying to refine these molecules to improve their fit, their drug-like properties, with the goal of developing a once-daily pill treatment for glaucoma. But here's the exciting part. Alpha-ketinin isn't just involved in glaucoma. We believe it plays a critical role in a number of diseases where inflammation causes neuronal loss, such as in Alzheimer's disease, Parkinson's, and brain injury. So this is just one of many drug discovery programs that we have at UHN, ranging from oncology to arthritis. Our goal is to actually reach a scientific inflection point. That is when data from molecule shows it has real true potential to work in humans. That's when we collaborate with industry to develop these further, ensuring discoveries made here in Toronto have a direct path to helping patients right here at UHN and across the world. So let's go back to where we began. Who would have thought that what started for me as fire and gunpowder would evolve into something far more powerful, creating molecules to transform human health? And if we succeed, we won't just be watching disease unfold, we'll be stopping it in its tracks. Thank you.
Wow, Mark. I have a question for you. Okay, I just find it so amazing, this whole molecular process. Like, I just have no conception of what exactly you do. So what's the biggest challenge for you in that whole process of creating a new drug?
Thanks for the question. So drug discovery is very difficult. I think one of the big challenges is being able to actually visualize that lock. So we need to design keys that fit that lock precisely, but just like a lock, you can't see inside it. So we need technologies and ways to see that lock to improve that fit. So that's a real big challenge, getting to that information to improve the molecules. I also think another challenge is translation. So taking what we discover in the preclinical phase into the clinic. And I think that was a real big reason that I was attracted to KBI. It's that close interaction with clinicians that really allows us to develop drugs not to treat preclinical models, but to treat human disease. And that really enables us to do that here at UHN.
Wonderful. Thanks very much, Mark. Mark Reed.